welcome to Doctor's Corner. Welcome back, I should say.
Thank you so much.
So what is endometriosis?
So endometriosis it's a very complex condition that affects menstruating women and a very painful condition as well. So basically it's a condition where there's tissue that is very similar to the inner lining of the uterus, which is called the endometrium, and this tissue is found outside the uterus.
Outside?
Yes, yeah. So it's actually found in areas very commonly found on the ovaries, on the fallopian tube, on the outside of the uterus, but it can even be found on the bladder, on the intestines, on the appendix, the colon. And so because it's in a place where it's not supposed to be, it can cause a lot of issues and a lot of problems for women.
And affect your quality of life.
Oh, it absolutely does affect your quality of life, yes.
So how do we know we have it?
So there are certain symptoms that are associated with endometriosis. One of the main symptoms, obviously, is pain. It could be a cyclical pain that's associated with a woman's period, either before or during the period. But it can also be like chronic pelvic pain as well. So that would be a pain throughout the month where, it doesn't matter if she's having her period or not, but it's just a chronic debilitating pain that she can feel. One of the other symptoms is her period could be extra heavy, or it could be an irregular cycle as well. And one of the other symptoms to look out for is also pain during or after sexual activity. So these are some of the signs to look out for. But there's also some other symptoms to watch out for as well. Fatigue is also associated with endometriosis, to the point where a woman has such a hard time just getting through her daily activities. But I think the big factor that what makes endometriosis so difficult is that it can affect fertility as well. So women who have endometriosis have a really hard time conceiving.
Yes, and like I said, it affects your quality of life, but also your work.
Absolutely.
Yeah.
Yes.
So, what causes it?
Yeah, so unfortunately, we don't really know what the cause is. There are some theories to explain, how the tissue got to where it is. So I'll just explain maybe a few of these theories that are currently being considered. The most long-standing theory is a theory of, called retrograde menstruation. And basically what happens is when, during the period, the menstrual flow flows backwards through the uterus. So back through the uterus, through the fallopian tubes and the ovaries, and then from the ovaries it somehow makes its way into the pelvic cavity. But this theory has also been challenged because even women who don't have endometriosis also deal with retrograde menstruation. So that may be explaining it, but we think there's more to it than just that. One of the other factors is genetics. So a woman who has a first-degree relative who also has endometriosis, for example, their mother or their sister, it actually makes them about 5 to 7 times more likely to have endometriosis. So there is a genetic basis there as well. And then the other potential cause could be an imbalance in hormones. So we know endometriosis to be a very estrogen-dominant condition. And so, just due to the nature of stress in our lives, the North American diet that we eat, a sedentary lifestyle, all of these contribute to higher levels of estrogen in the body and a disruption in our hormones.
Dr. Mistry, how do you treat it?
So with endometriosis, because it's a complex condition, I think a naturopathic approach works very well because we treat the whole person, right? So we take a very holistic approach, but we also individualize it to the patient specifically. So depending on what their symptoms are and what they're going through. So because endometriosis is an inflammatory condition, the biggest goal is we want to reduce the levels of inflammation in the body. So we usually start with working on diet, so making some diet and lifestyle changes. So with diet, so I usually counsel my patients to choose more anti-inflammatory foods. So that would be eating more brightly colored fruits and vegetables because they're very high in antioxidants. and also choosing foods that are high in omega-3s. So having wild salmon, chia seeds, and flaxseed. So that's really important. And then at the same time, reducing the inflammatory foods, right? So that would be cutting down on coffee, reducing alcohol intake, decreasing dairy, red meat. And so these are all the things that tend to cause inflammation in the body. So we work with that. And then in terms of reducing the pain and balancing the hormones, there's a lot of botanicals that can be used. We use acupuncture. Homeopathics can also work very well. So we use a combination of different natural therapies to address endometriosis.
Yeah, so tell us, some of your patient success stories.
So I've seen quite a few patients with endometriosis, and what I'm noticing is that the prevalence is increasing. Like, I'm starting to see more and more. So that's why I really wanted to come and talk to you about this. I think with some of my patients, the main focus would be to reduce the pain that they're experiencing, and also to help to regulate their periods so that they're not bleeding excessively every month. So recently I did have a patient who was having very heavy menstrual bleeds for several months, but we ended up working on diet to reduce the inflammation in the body. There were certain botanical herbs that I gave to her, and then even some homeopathics were part of the treatment plan as well.
Wonderful.
Yeah.
And so, for resources and people watching the show, what could you suggest?
Yeah, so the biggest thing is to be informed, right? And there's a lot of great resources that are out there. One of the ones I wanted to mention is called endometriosisnetwork.com. And so they have a lot of good resources there. One of the most important things that they have is links to support groups. So especially for women who are dealing with endometriosis, it can be quite isolating, and you kind of lose yourself in the disease because you don't recognize who you are anymore. So it's really important to have the support of your friends and colleagues, but also other women who are dealing with endometriosis.
Going through it, and also too, it's not something that people want to talk about.
Right.
And it's lifting the stigma and raising awareness, education.
Absolutely.
And would it be 1 in 10 women in Canada?
Right. So that's the current statistic. So 1 in 10 women, menstruating women, have endometriosis. But personally, I think it's an underrepresentation. I think there's many more women out there who have endometriosis and don't realize that that's what it is.
Yes, and if people are wanting more information, where can they go?
So they can, I would definitely advise them to seek medical attention, to meet with their medical doctor or their naturopathic doctor. There's the nurses hotline as well, which is a place where at least you can get some information. And even online, there's a lot of good resources out there as well.
And what about you, Dr.
Yes.
Mistry?
And so as I mentioned before, I work downtown in Vancouver. And so, I tend to see a lot of patients with, I deal with women's health issues, digestive issues, mental health issues as well. But endometriosis is something that I'm very passionate about, and would love to help many women with it.
And before we leave, Dr. Mistry, how is it diagnosed?
So the diagnosis of endometriosis is quite challenging. One of the biggest issues with it is that women tend to get a delayed diagnosis. So there was a research study done in 2011 by the World Endometriosis Research Foundation, and what they found was when a woman first experiences symptoms to when she actually gets the diagnosis, on average it was about 7 years.
7 years.
7 years, yeah. So a lot of women are suffering for many years before they actually figure out that they have the condition and are getting treatment. So, but one of the challenges with diagnosis is that because the symptoms are, pain with menstruation and having a heavy bleed, they're often dismissed, right? Saying that's a normal part of having a period, when in many of those cases, it's actually endometriosis that's causing these issues. So the definitive diagnosis is, doing a very good health, or actually doing a very good health history, having a pelvic exam done, Unfortunately, with lab testing, there aren't any labs that can diagnose endometriosis. So the definitive way to diagnose it is to have a laparoscopic surgery, and I think that's one of the reasons why it's a delayed diagnosis as well, because it's an invasive technique. But a surgeon would actually have to go in to visualize, how many of these endometrial implants are present and to biopsy that tissue.
Wonderful information.
Yeah, thank you for having me.
Yes.